The following video describes system preparation and instructions for use for the Cook Medical Hemospray endoscopic hemostat. Intended use. This device is used for hemostasis of non-variceal gastrointestinal bleeding. System preparation. Step 1. Remove device from package. Note: do not over-rotate knob, as this could damage the device. Note: do not test device prior to insertion into endoscope accessory channel, as this may increase risk of catheter occlusion. Step 2. Activate CO2 cartridge by turning red activation knob until it stops. Instructions for use. Caution: ensure gastrointestinal lumen is not distended because Hemospray adds volume during procedure. Step 1. Before inserting catheter into accessory channel, identify bleeding site, remove as much blood as possible, then flush the accessory channel with air. Precaution: to avoid catheter occlusion, do not place catheter directly in contact with blood and/or mucosa, including any pooled blood, and do not aspirate blood while catheter is in accessory channel. Note: to limit fluid from entering the working channel of the catheter, temporarily occlude the proximal end of the catheter by placing a thumb over the red catheter hub, while advancing the catheter down the accessory channel. Step 2. Slowly advance catheter through accessory channel in short increments until catheter tip is visualized endoscopically. Step 3. To ensure proper visibility, catheter tip should be 1 to 2 centimeters away from bleeding site at all times. Step 4. Attach the catheter to the handle, ensuring the connection is secure. Note: device is now active and ready for use. Do not press trigger button until powder deployment is desired. Step 5. To allow powder deployment, turn red valve to open position such that the valve is parallel with the direction of spray. Precaution: the first press of the trigger may not deploy an adequate amount of powder to achieve hemostasis. Press again to continue the movement of powder through the system. Note: allow time for hemostasis before aspirating. Hemostasis may not be immediate because the powder takes time to absorb. Multiple applications may be required. However, no more than 3 Hemospray devices should be applied per patient. Note: irrigation of treated site is not required after deployment. If irrigation is desired, allow time for hemostasis before irrigating with water. Note: to avoid potential endoscope occlusion, do not aspirate powder into endoscope channel. Scope suction can be turned off or disconnected temporarily to avoid accidental aspiration of powder into the endoscope channel, which may cause endoscope occlusion. Step 6. To deploy powder, hold handle upright and depress red trigger button for 1 to 2 seconds and release. Continue applying in short bursts until site is completely covered with powder and no active bleeding is visualized. Note: if catheter becomes occluded, turn red valve to closed position. Remove catheter from endoscope and replace with extra catheter provided in package. Then repeat steps 1 through 7 of Instructions for Use. If more powder is needed and spray canister and/or CO2 cartridge is empty, a new device is required. Step 7. Prior to removing Hemospray device from patient, turn red valve to closed position. To remove device from endoscope, grasp catheter and pull slowly. Upon completion of procedure, depressurize device by rotating activation knob counterclockwise until CO2 cartridge depressurizes completely. Dispose of device per institutional guidelines for biohazardous medical waste. For additional information or support, contact your local Cook Medical representative.